Welcome to the Exam Room Podcast, brought to you by the Physicians Committee. Hi, I'm the weight loss champion, Chuck Carroll, on location in Rochester, Minnesota. But thanks for joining us coast to coast and around the world, wherever it is that you are. We appreciate you raising your health IQ with us and making the Exam Room one of the most consumed nutrition podcasts anywhere on the planet today. And it is an honor to be joined by Meiping Liu and her husband, Dr. Jengyu Lai. Thank you guys so very much for, one, welcoming us to Minnesota, and two, putting on such a phenomenal event.
Well, thank you very much for coming. It's an honor. It's a kind of a dream to have you come to Rochester finally.
It's really my honor to be here, and I'm really blown away by the level of speakers that have been brought in here. We had Dr. Eddie Ramirez on the show, Brenda Davis, of course, so many others who have come through your doors. How are you getting all of these dignitaries to come to Rochester?
You want to start?
That's all yours.
Well, actually, that started from 2014, the first time when we were introduced to American College of Lifestyle Medicine Conference in San Diego through our physician, Dr. Thomas Harmon. And we were blown away by how much energy and information that we received and feel at the ACLM conference. And we kept going back for 10 years, pretty much. And our goal at that time was to bring those top-notch speakers come to our community to bring those knowledge, not only for the community folks, but also for the medical professional. You know, Rochester, Minnesota, that is well known for a medical town.
Absolutely. And as a doctor in Rochester, you work as a podiatrist, but you also practice lifestyle medicine.
Right.
How is the health of this community overall?
In theory, it's pretty good.
In theory.
Right. But just like we all see, I think Dr. Dysinger yesterday mentioned, when you want to build your health, you need to have a good foundation. Just like you build a house, you don't want someone who is just very good at building the second floor. And this town is very good for building the second floor. And our job is to lay the foundation. It's a community health. That's why this symposium is called Community of Wellness. Our goal is really to build this foundation for everyone in the community, and then the other medical center can take over for the second floor.
Now, I've been privileged enough to have so many doctors who practice all different specialties of medicine on the show. I don't think I've ever had a podiatrist on the show before. It seems to me it's an interesting combination where you're able to blend that with lifestyle medicine. What is the connection between the two?
People don't think about podiatry as part of lifestyle medicine, but just like physical activity, we talk about walking. And when you walk, you don't just walk without your feet. And when we treat feet, I usually tell patients that the feet don't come in by themselves. Now, it's a whole person approach. When I prescribe medication, the medication doesn't just go to your feet, go to your leg. That goes through the whole body. So it's I believe it's very reasonable or logical that when you look at the feet, you look at the whole person. Even in terms of our mechanics, there are two schools of thought. Do the legs control the feet, or the feet control the legs? No, it depends on what you do, the time of the day or activity. No, and when we look at the foot and ankle, a lot of time, your problem from your back, from your legs, contribute to your foot and ankle pain. But sometimes your foot and ankle pain come from your upper, like the lower back and your side, your hip. And so it's really reasonable that you want to practice good foot and ankle care, you need to look at the whole person. And when you want to have a whole person wellness, you want to have very good foot and ankle health.
We talk a lot about diabetes on the show, and one of the symptoms that people who are suffering with diabetes talk about a lot are issues with their feet. How many of your patients come through your door suffering from diabetes and in turn are having issues with their feet?
Quite a lot. Is I would say at least 20-30%. But the thing is, a lot of times they don't even know they have diabetes. I have to look at their medical record, their previous medical record, and found out that they have a diagnosis of diabetes. Or sometimes they deny it. It's really in denial. They say, oh, I don't have diabetes. And I say, oh, well, look at your medical record. Before you came here, there's a diagnosis of diabetes. And they'll say, oh, it's not something really a problem. It's just a little bit of high sugar. I don't have diabetes.
So May, you see these patients come through the doors at the Rochester Clinic. You see the type of issues that they're having. Does that help you then formulate the ideas for how it is or the speakers that you want to bring in at the Lotus Health Foundation Health and Happiness Symposium?
Well, before we get to that, I was very frustrated before we started our clinic in 2010 as a finance director of two nonprofit organizations. Every year, I was just pondering on the rising costs of the medical health insurance, because it's never been a solution to keep upgrading your policy, as it's never be able to have enough funding to cover the growing chronic diseases, in the staff team. And so the same thing when we had our clinic, people come in the door, majority of them are suffering from the chronic diseases. So we feel like it's kind of overwhelming. If we want to educate people about a way to control their chronic diseases, we gotta do something, which is education. And that's why one night, I think it was a winter, we were so frustrated to say, that's a form of nonprofit organization. So we are able to bring all these, knowledgeable lifestyle medicine experts come to the community and do a community level education. And so I think that serves the purpose of to educate the people, but also the healthcare providers. As a lot of the healthcare providers, they didn't have this lifestyle medicine training at their school. So that's a start from that small inspiration at ACOM conference, and then during our practice, our frustration and kind of coming to this point. And we made a lot of connections at the ACOM conference, and we know that there are a lot more outstanding physicians. They are so passionate about making the change in the world, especially our mentor, Dr. Hans Steele, and also Dr. Barnard at the PCRM.
And I'm not sure if you two are aware of this or not, but you are really putting Rochester on the map. Rochester, very well known, obviously, for the Mayo Clinic, but you guys are really making this a hub of lifestyle medicine now. And I'm not sure that you two are aware of the impact that you've had just a relatively short amount of time. But people know to come here now, and this is a place where lifestyle medicine is embraced. So on behalf of the exam roomies, I just want to say thank you for all of the tremendous work that you're doing.
You're welcome.
Thank you. Well, I want to clarify, it's Rochester, Minnesota, not Rochester, New York.
Important distinction, absolutely. That's pretty funny. But do you feel like you're starting to reach people like an hour or so away in the Twin Cities, the St. Paul, Minneapolis area? Are you seeing patients come through your doors specifically because you practice lifestyle medicine?
We do. I cannot say a lot, but we do. We do have patients coming from Twin City just to see us because of the lifestyle medicine practice.
Sure.
And majority of our volunteers in our event actually come from Twin Cities.
Yeah.
And we regularly do presentations in the Twin Cities as a community education too.
As far as the community, our mission is to promote the lifestyle medicine education in the community. The community it's not just for Rochester, because in overall we want to spread the word to the rest of part of Minnesota, and so whenever we went to do some health talk or to show up that we have there's an opportunity, an option for people to pursue the care from lifestyle medicine practitioner, we receive an overwhelmed response, and they have been asking whether we can have a clinic in the Twin City. But in the past couple years, people heard about what the foundation do and also the clinic's practice. We generally receive some response and people come to here. But one day, we hope that this community education can really expand to broader scope, which is, reach far out to more than just Twin City, even in the St. Cloud, and which we have a couple physicians travel that far come to speak as well.
Outstanding. And what is the goal for the symposium that you put on through the Lotus Health Foundation? It is growing year by year. Obviously, we see the caliber of speakers who are here, which rivals literally any health conference who I've been to. The lineup this year is just amazing. Dr. Eddie Ramirez, Brenda Davis, who have been on the show, so many others. And I know in the past, Dr. Michael Greger has been here. It's just been a phenomenal who's who in this industry. How would you like to see the symposium continue to grow?
We'd like to see 800 people. We'd like to see more. We'd like to reach out to people who have not heard about this. We want to increase the size of the like-minded people, especially healthcare professionals. We are very grateful. Over a period of time, we have again some friendship, with the physicians from Mayo Clinic who are like-minded, Dr. Carlson and Dr. Musalem, that they have been a great advocate for lifestyle medicine, for what we do, and they have been able to connect our speakers with Mayo Clinic to give them a grand round. I think that is a big milestone for us. And especially this year, we also received the proclamation from the governor, Tim Walz. And our goal is continue to gain the support from the local authorities, so be able to widespread the word about the lifestyle medicine to reduce the chronic diseases, to become a much healthier state.
Outstanding. And not only did you get the proclamation from the governor, we got one here locally from the mayor of
Kim
Rochester,
Norton.
Mayor Kim Norton.
Yes.
Was here. And doctor, let me ask you this. The mayor yesterday was talking about her efforts to really kind of curb sugary drinks, sodas in schools. I'm not sure that there's been a particular study on sugar-sweetened beverages and podiatry, but if there has been one, are you familiar with it?
Not podiatry specific, but mostly on diabetes. Right. Because as you mentioned earlier, one of the most severe diabetic complications are on the feet. Diabetes from the neuropathy, circulation issues, ulceration. So it's mostly through the diabetes.
Gotcha. And in terms of inflammation, when you have tissue issues, muscle issues with your feet, what would a whole food plant-based diet do for somebody who's really struggling and every step is painful?
Well, there's two aspects. Number one, pain is one form of inflammation. So if you have pain, you want to reduce the pain, anti-inflammatory diet, they'll cut down your pain right away. Secondly, it usually is a form of injury. When you want to heal your injury, proper nutrition is very important. Especially we hear about everything is collagen supplements. But when the body want to produce collagen, we need special cofactors like vitamin C, zinc, and copper. And those we can get very good from plant-based diet.
Gotcha. So what would you say, and I hate to do reductionist questions, but people, they just love them. So if somebody were really interested in taking their diet to the next level to reduce that inflammation, what are some of the foods you would say to zero in on?
Number one, I ask them to not eat dairy first. The food that will increase the inflammatory responses in the body, dairy, refined sugar, we cut that off first. And then we increase dark-leafy green. We want berries, it's very good, and also nuts and seeds.
And you don't just write prescriptions to fill at the pharmacy, you also write prescriptions for produce. What is that all about?
Right. We have a community garden right next to our clinic. It's actually called Pharmacy RX. FARMACYRX. Pharmacy RX. It's very, that will mention that you really need vitamin C for your collagen and also the produce of plant-based diet. Instead of just writing the prescription or pharmaceutical prescription, I'll ask them to pick up more fresh produce from our pharmacy garden.
Mm-hmm. What kind of vegetables and fruits are you growing in there?
We have the staple of the tomatoes, of course, but we have a lot of dark leafy green like kale, like that, and also basil, herb, that type of thing.
Watermelon.
Watermelon is huge,
And
yes.
winter melon.
A lot of squash, yes.
Yeah.
And our goal is really make it a true prescription pad that we can write a prescription, just like Dr. Dassinger yesterday mentioned. I'll write down green produce 3 times a day or something like that, and then they will be able to fill this prescription at any farmer's market or some farms.
But they get to take some home with them from the clinic that day as well?
Yes, absolutely. And when you go to some clinic or some business, you see they have a bowl of candies.
Yeah.
We don't do that. We have produce.
We have a bowl of tomatoes, whatever we pick that day. Wow. So people can take away. They are just, our patient was so surprised and they kept asking, are you sure this is free? I said, yes. Sometime, well, I think I should go back to the reason why we have this pharmacy arts community garden, because our we have a open lot. It's waiting for the expansion from the clinic. But in the meantime, we feel like, wow, this is an empty lot. We should do something about it, especially during the pandemic time. We got to do a lot of things outdoor to enhance the emotional health. So we realized that to convert an open lot to a community garden is such a great idea. We gather anyone welcome, especially the volunteers that come to do a little bit whatever they can. There's no age limit. And so we make this as a no-till garden. Just to put a tarp in and kill the grass underneath it and then dig the hole and just transplant that. We also receive a lot of support from local nursery store. They donated some vegetable plants. So whatever they gave us, we just plant in the ground. And so this garden also serves as a great tool for lifestyle medicine practice. You want to talk about that?
Oh yeah, I had a presentation. I had a presentation at our gardening club 2 months ago on how gardening improves your lifestyle. Mm-hmm. So we talk about not only the fresh produce, the plant-based diet, you also have the constant movement, gentle movement. You have the social networking because it's a group of people. You're doing the gardening together and reduce your stress, and you have the purpose of not only seeing them grow, you also help people with your produce. So it does a lot of things. And then sunlight, just like Dr. Eddie Ramirez talked about today, that's melatonin. Under the sunlight during daytime actually induce melatonin production at night. So it serves a lot of purpose of the lifestyle medicine.
And I would imagine that with that fruit, the vegetables being so ultra fresh, they are absolutely delicious. And I think that that's really going to excite the patient about moving forward in that direction too.
Absolutely. There's a research study actually show that vitamin C in the produce will begin to degrade as soon after being harvested. And after 5 days, the amount of vitamin C is almost zero. And think about in Minnesota, if we rely on produce coming from Mexico, California, it takes more than 5 days from harvest to the shelf. So if you really want to have a vitamin C, you really need to get fresh produce from your local farmers.
And we also use a garden as a project to teach people it doesn't take a lot of effort for them to do the gardening, especially no-till method. We even don't do the fertilizer. And the vegetable just will grow very happy, especially last year when we had the watermelons. I didn't believe that we should grow watermelon because you can get one puppy for only $5, but it tastes so different. And so this year we're going to grow more watermelons. Not only that, when patients come in and they see the growth of the garden, and once they see most of the green grow up like an ocean of a green, they normally like to wait outside just to have that moment. They say that is so healing. So garden actually is very healing for patients, and they reduce their anxiety. We also be able to donate more than 3,000 pounds of produce to 10 nonprofit organizations.
Holy smokes.
So yeah, it's amazing for how much the garden can do. So we actually encourage other practice or local business together to do something similar. Then you don't have much problem about the shortage of the food, and create a sense of purpose as an entire community.
So you actually teach the patients how to garden themselves?
Yeah.
And cook.
Yeah, we do a lot of a cooking demo. We even set a booth, just a table outside of the clinic, and we just do the cooking demo. Sometimes we have like a group of maybe 30 school children with their parents came, and they were so excited. The kids love it to do something, and we just let them kind of show off, and they really catch up things very quick. And so then also they gather the free producer home to cook again with the recipes, and that is the purpose of the teaching.
Wow. So let's just walk people through beginning to end here with the treatment process. They can come to you for regular treatment.
Yes.
And then they also get all of these side benefits, learning proper nutrition, learning how to grow their own produce, and how to cook it.
Yes. And they receive a recipe as a prescription.
Yes.
You guys are the total package.
Well, Dr. Loomis from PCRM.
Yeah.
I had a patient 2 days ago. She and her friend are running a marathon in Twin Cities tomorrow. And I gave her Dr. Loomis' recovery smoothies recipe.
Dr. Jim Loomis. Yeah, I will pass that on to him. He's a good friend of mine. That's unbelievable. Well, look, that is all at the Rochester Clinic, and I highly recommend you check that out. I may fly back in just to check that out. That is unbelievable. And again, the show description has the link to the Rochester Clinic, all the contact info there. Thank you both so very much for being here. This has absolutely been tremendous.
Thank you. Welcome back. Thank you so much.
Thank you.